Okay, so maybe this will bring back some memories of QA, QC, et cetera. So, we talk about artifacts and pitfalls, but when you think about it, these are actually different categories. So artifacts are usually related to technical factors. So injection technique, the technology, the image acquisition, the protocols you use, reconstruction, the implementation, and it's independent of whatever tracer you have. So the solutions for solving artifacts is a little bit different. Whereas pitfalls is on us. It's all on us. It's all interpretation. It depends on what radio tracer you're using. It's our understanding of the distribution of it. False positives and false negatives based on interpretation and perception. So these are related because artifacts can lead to pitfalls, et cetera, but you have to deal with them separately, so it's helpful to think of them as differently. So again, going back in time, you're looking at the technology we use, the gamma camera technology. You have these round photomultiplier tubes, you have the collimator, and then the crystal for detection, and then the technology to interpolate and localize where the events occur. And this is when you take that apart. And now there's newer solid state versions of this. So these, instead of these PMTs, they're these solid state detectors. So it's very similar to our old CRT televisions that used to be so big, and now with HD TV, solid state, pixels. So kind of think of it like that. And the things that you really need to worry about is uniformity and collimation, because after all, that's what we're looking at. We're looking at images here, and any disturbance of this uniform distribution, will lead to falsely high or low points of activity. So this is a flood image using cobalt 57. And this is done every day to calibrate the uniformity so that the electronics go and make this a smooth image. And again, it's the residence board questions, like how much you increase the acquisition time, how much does that reduce or improve the signal to noise, when you do that. So the image for 256 seconds, it's a square root of the number of counts, but you can see it gets better and better as you image longer, so you get the smoother image for the flood, and you want this to be totally uniform. If it's not, you can lead to artifacts like this. So this is
what I'm going to focus on this morning is radium-223, which has been a little bit of an interesting story. I kind of look at radium as maybe the first wave of our current era of theranostics. Radioiodine therapy obviously has been around for decades. It was one of the first therapies that was used to treat thyroid cancer. We had some palliative agents, we had some earlier agents, but this really ushered in the era where we started to look at radiopharmaceuticals as a means of treating cancer. And so when radium came along, I think we learned a lot of lessons that were really useful in the early days that paved the way for some subsequent therapies such as PSMA, as you'll hear in the next presentation. Just as a quick review, to talk a little bit about where we are with thinking about these radiopharmaceuticals for the treatment of cancer, recall from our early college physics days that there are essentially 4 types of radioactive decay that occur. We have gamma decay with release of a gamma photon, no charge, no mass, but high penetration, so we use those for our diagnostic radiopharmaceuticals to be able to capture those photons. We have beta decay, which traditionally, at least when I was in college, we thought of as electrons. Things like iodine-131 released an electron during the course of decay, although positron decay is also beta decay. It's a beta plus particle instead of a beta minus particle. So these are a charge of either +1 or -1. They have a penetration of about 2 to 3 millimeters in tissue, depending on the energy with which they're released. They have relatively low ionization potential, but they do cause some local tissue injury, which is why we use these for therapy. Protons, just to throw that in there, there are only a few agents that decay via proton emission, but obviously proton radiotherapy has become a very hot topic in the field of radiation oncology. A charge of +1 penetrates the tissue. Because of the higher mass, it has a higher energy deposition. So the rest mass energy, which is kind of our measure of how much damage that's going to do when it stops, is 938 mega electron volts. And then alpha therapy, in which there's a lot of interest these days. These are particles that are 2 protons, 2 neutrons, generally occur via decay of heavier isotopes. They have a rest mass energy of 3,800 mega electron volts, and so as you can imagine, they cause a large degree of tissue injury when they stop because of that charge and because of that mass. Because of the charge and mass, though, they only penetrate a short distance in tissue, usually just a half to about 1 millimeter, again, depending on the energy that they have. So they have the highest ionization potential. We think about this in terms of the relative biological effectiveness. And again, this brings me back to the early days when we were in residency and had to memorize all these charts and tables about, what the RBE values for various things were. It's a somewhat arbitrary number that's assigned to the amount of damage caused by ionizing.
I'm going to talk a little bit about some instructional cases as well, but I also wanted to kind of go through general nuclear medicine studies for infection because that's an important topic. So I'm going to try to do that in my last talk for this session today. So here are my 2 disclosures, has nothing to do with this talk. So I'm going to start at the basics. And I know we have a wide variety of expertise in nuclear medicine in the room. But for a very simple case, especially a pediatric patient where you don't necessarily want to sedate the patient and have an MRI, but this is a 5-year-old who was bit in the hand by a dog 2 weeks ago. Initial x-rays were negative, and then had a repeat x-ray because the patient had fever, redness, and pain. And they were really concerned that this patient could have osteomyelitis with an infection after the dog bite. And so when we do any kind of study in terms of nuclear medicine for infection, usually the first study that we do is a 3-phase bone scan. And there's 3 parts to this. The first part is when the technologist injects and we get imaging over the first minute, and that's usually called a flow phase or angiographic phase. And we can see in this particular patient, this is a little bit of older case, so this little dot, technologists would often put that to indicate this is the right side, so this is the left side. So the left hand has more activity overall than the right hand. And then this is a tissue phase image, or some people call it blood pull, but I think tissue phase is more appropriate. It really looks at the soft tissues, and there is some uptake or activity around the second finger here. And then we do a delayed image around 3 hours, and on this delayed image we can see that there's more uptake at the base of the proximal phalanx of the left hand. And this is a 5-year-old, so we were able to do pinhole images and really get a nice representation of exactly where this uptake was. So this is a positive 3-phase bone scan. There's increased activity in flow and tissue phase images, and it localizes to the bone. On delayed images or skeletal phase, there's no confounding factor, so we can say definitively this patient has osteomyelitis at the base of the proximal phalanx of the index finger. So the first teaching point is, if you have an uncomplicated case such as this, this may be all the imaging you need. It's very sensitive, and in this case, there's no confounding factors. So this is osteomyelitis. But what if in the same 5-year-old, they're not worried about infection anymore, but they're worried about fracture from the dog bite? There's no evidence. So that could have been the same picture for fracture as well. And very rarely, if you had a malignant bone tumor, you would have the same.